Company Showcase by RenewRx.
Kari, did you know that when we give better prenatal care, we're actually bankrupting our practice? Wait, what? That's right, because reimbursement for prenatal care doesn't matter if it's 8 visits or 13, we are still getting the same amount of money for the practice. And to top it off, we're floating nearly $8 million a year because prenatal care isn't actually available until, the reimbursement for prenatal care isn't available until after delivery. Wow. So you're telling me then, if I'm seeing a patient because I care about her and I want to make sure she's doing okay, and I'm seeing her more often, I'm actually costing the practice money? Yeah. And because the reimbursement isn't available, because she's taking up a slot for another patient, that means we're not getting the reimbursement from another patient that could have been filling that slot. Exactly. So the system isn't broken, it's just backwards. And that's the opportunity for reinventing. Patients need fewer visits in office, but they need more support between. And practices need new revenue. That's where RenewRx comes in. We are a patient app, a medical provider dashboard, and behavior-based habit-building coaching. The most important part is that when a clinician sees a patient, they set the destination with the patient of where they want their health to go. Then we, RenewRx, are based on the patient's real life. How do you actually get there? What habits do you need to create or change to get there? And then just like a GPS, we are adjusting based on her own biometrics. So through a glucose monitor, through AI food scanning, and so much more. We can adjust course and make it so she can get on track. We started with the biggest pain point, diabetes and pregnancy, both for clinicians and for patients. Like my patient Sarah told me, when I got diagnosed with diabetes, I had to poke my finger 4 times a day, twice the number of doctor's appointments, and change my nutrition and lifestyle overnight. And I didn't know what to do. And we've proven it works, bringing brand new reimbursement to the practice, up to $1,000 per patient per month, using existing CPT codes that are already exponentially growing. And with 96% retention and 100% patient and provider satisfaction. We brought hundreds of thousands of dollars to the practice and to RenewRx since we started last year. And just over the past 3 quarters, 105% growth, with national expansions underway. As you can see, the momentum is real here with my co-founder in Times Square. We have strategic partnerships and also are expanding nationally and just actually got a letter of intent to expand programs into Saudi Arabia. And we've proven that this works. Moms using RenewRx have better glucose control than standard of care. That translates into real outcomes that save not only patients money, but insurance money. And payer contracts are in the future. Just using the diabetes and pregnancy market alone, and 6% penetration, we are at $34 million annual recurring revenue by year 5. But listen, pregnancy isn't just the beginning, and diabetes isn't just the beginning. In fact, we are a women's health platform that starts in pregnancy, when someone's the most motivated in their life and the most connected to their medical provider, and we stay with them for a lifetime. And that is a $60 billion opportunity. Our business model is simple. We partner with medical offices. They enroll their patients. We provide services. We bill them for those services. And then they bill insurance. We maintain a 70% margin, and they net 30%. That translates nearly into an additional $1.8 million that their practice never had access to before. They continue with this partnership model to enroll new patients into RenewRx. That ultimately now allows them to become our sales channel, dropping our customer acquisition cost to nearly 0. But here's the best part. While we are earning $2.5 million from that partnership, Where we really see the huge opportunity is these moms, 90% of them want to stay on beyond pregnancy. That means now they become a RenewRx patient because they're no longer getting their prenatal care anymore. We then provide them lifelong support, and then we are billing insurance, keeping 100% of that revenue. So we've now turned a 3-month episode of care into a 30-year lifelong engagement, which translates per patient into $72,000. The offices keep enrolling more pregnant patients, and exponentially, our opportunity gets bigger. So as an investor, when we unveil this in January, and the true potential for what our seed round will look like and the opportunity for you as an investor, this is where you can see the true return on investment. Not only am I a clinician, but as Nicole mentioned, I'm also a professionally trained chef, and I know the power of food as medicine. That's why I'm partnered with Kelly Carter, bespoke renowned coach for nutrition and lifestyle support, and we've used technology to scale the impossible, scale what coaching for integrated into prenatal care can be. And we're guided by experts that check all the boxes. If this investment opportunity excites you just as much as it does for me, let's partner today, create a relationship, and invest in us in creating a relationship. And when we open our seed round in January, you'll be the first person to know. Please scan this QR code and let's connect today. Once again, my name is Kari Cao, and we're here to partner with you. We're not just solving a prenatal care cash flow crisis. We are creating lifelong engagement for patients, bringing brand new revenue to practices that they've never had access to before, and saving payers money. So let's build this GPS together. Thank you.